Well, hello, my friends, and welcome to today's episode. Today, we're going to be talking about friction management in modern medicine. This is a rare time where I'm recording back to back episodes. I had just finished recording last week's episode, and it occurred to me that friction management is really the work of boundaries. And we can think about dialing up or dialing down friction as something that is a helpful tool for helping us to manage the overwhelm and the overburden of all of the things. And so, friction management in principle, I just finished recording a podcast. I'm like, well, I'm all ready to go. My stuff's all here. Might as well record a second episode. So, with that, here we go. So, in last week's podcast, one of the things that I went off on a little mini rant tangent about was the introduction of the Epic Chat. I'm not even sure what it's called because I'm not on Epic, and thank goodness I managed to avoid this tool before it hit Epic when I was still working in my prior job. But whether it's Teams, whether it's Epic Chat, just these live chat functions that are meant to be able to ping us instantly, not unlike text messaging, right, or DMs or any other sort of instant communication, but it's actually meant to interrupt us while we are in the exam rooms. Again, thank goodness I avoided this because I can tell you I just would have been so incredibly pissed off and annoyed all the time before I knew how to sort of manage my own sort of thoughts and feelings around this. But I imagine that the majority of you are dealing with this in some kind of context. In my office, we have REMR, which doesn't have that capability. We do use Slack to communicate, but I feel really 0% obligation to be checking Slack, and I don't have it pulled up on my laptop as I'm seeing patients. It is on my phone, but there's no notifications going off in terms of there's no sound, right? Because I put my phone on do not disturb. And so I have full permission to completely ignore it. In the rare times that my office will, come and interrupt me, and it's literally only 10 steps from the front desk to my exam room, they do have to knock, and they do it thankfully so rarely um, that I feel incredibly lucky to be in that. But so many of us are dealing with these constant interruptions, right? And you can think about the tools like this, right? Whether it's this Epic Chat or Teams or something that is meant to reach you while you are taking care of patients, they have reduced the friction involved with other people on the care team messaging you. Now, that sounds wonderful, but what happens in practice is that people are constantly trying to interrupt you and wanting immediate gratification of their question, dilemma, problem. And sometimes people are doing this to avoid their own discomfort with having to tell someone no, having to make somebody wait, or navigate the problem in some other way. So I'm going to give you the classic example is your front desk staff being connected to you through this chat function. You're seeing your patient and ping, right? You get a message that says, oh, Mrs. Jones has checked in. She's 17 minutes late for her appointment. And I know that the cutoff is 15 minutes, but we just thought we would check. That is someone who, for whatever reason, whether that's kindness or their own discomfort with telling Mrs. Jones no, is choosing to not uphold the policy without getting you involved because there is a low friction way for them to reach out and communicate with you so that you get to be the decider. So notice all of the different elements here. So there is you, the human being, who is being made to be the bad guy because Mrs. Jones and the person at the front desk are both hoping that you are just going to blindly, ignore the fact that she is 17 minutes late for a 20-minute appointment. We're going to put privilege aside. We're going to put navigation up the clinic aside, we're going to put aside all those challenges, right? This 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 group of people, right? The front desk person and Mrs. Jones are now waiting to hear whether you will uphold the boundary or not, right? So there's that element of it and your own emotional reaction to that, let alone your interaction with the patient is in the room right now that you are talking with, and this interruption has popped up. We've also got the fact that there probably is a policy, right? In this instance, right, we've got a 15-minute, if you're after 15 minutes for your 20-minute visit, you can't be seen policy. Somebody is choosing to not uphold that. Now, it's possible they don't know about it. It's possible that they're uncomfortable holding it up. It's possible that they just see that this is a low friction way to get around the policy and around their discomfort. But whatever is going on, right, that is at play here, right? And then we've got the front desk person who's dealing with whatever it is that they have to manage. Now, I don't want to suggest that I think that the front desk is necessarily an easy job because let's be honest, people are mean to the person at the front desk. They are upset about their copay. They're upset about the policy. They're upset they can't just walk in and be seen immediately. They're upset because they're having a bad day and they think there is very little consequence to treating this person who's at the front desk like crap because this person is the barrier that they see between, themselves and getting whatever it is that they want. People are rude on the phone. We know that this is unfortunately reality. So I don't want to besmirch the front desk person and their lived emotional experience. But, right, we can see how this is another instance where reducing the friction in healthcare has created this instance where now you have more friction because you have to decide, am I going to say no, even though this person is outside of this boundary that is, established within the clinic and it's here for a reason to continue the flow of care in a certain way so that the patients, are seeing that they have their needs meet. We could go on and on, right? But friction management is what we end up needing to do. And so today we're going to talk about that. We're going to talk about places where friction has been removed, and that is not a good thing. We can talk about how to dial up the friction, or we can talk about how to dial down the friction. And I'm going to give you examples of where I think that we as individuals need to dial up or down the friction and see how that affects us again as human beings. So if you are listening to this rambling intro and you think, this isn't a problem, I don't see what the big deal is, I don't mind that I'm being messaged constantly, this is probably just not the episode for you. No problem. You can skip this one. If you are sitting there and you're nodding, you're like, oh my gosh, yes. Why is this going on? Right? I need help. Then, my friends, I am here for you. And let's talk about ways that we can manage friction up and down so that we can help ourselves to be able to feel less burned out, less overwhelmed, and maybe even enjoy things a little bit more. So let's jump in with places where we want to dial up the friction. So this is my own list of places. It is by no means complete, and please feel free to, think about places that you want to dial up the friction more, places that you need more support in. And hey, I'd love for you to send me your ideas, right? Because I love to be able to help other people to be able to get the support that they need. And I'm just one human, right? So I'm not going to have thought of everything. But let's start with the example that I just mentioned of the staff communications that are not urgent in a medical sense and not medical. Mrs. Jones checking in late for her appointment is not urgent in a true sense. It is time sensitive, right? Because she's here now and somebody wants an answer. But assuming that Mrs. Jones is not clutching her chest and, on death's door, which, my friends, she should not be in your clinic. Anyway, that's a whole different issue. But let's just say that she's coming in for her regular follow-up or her wellness visit or her, twice yearly diabetes check. Like, she's coming in for a not acute, not going to die kind of issue. She's late. There's no medical triage to be done. And again, it's not urgent in that it is appropriate for you to be taking your attention away from the patient who is in front of you, right? The person whom you are making medical decisions, right? And you should focus on them. So this kind of communication has become much more common, and we need to be willing to increase the friction here. And there's a few different ways that you can do this, right? So again, if we are using an Epic chat, Teams chat, something of that nature, you can simply not answer it. You can simply not answer that message. You can tell just from that briefest glance that this is about someone at the front desk, or someone, has come in with forms that they want filled out instantly, or someone just dropped by to see if you're available to chat, or something of this nature. You have permission. I'm giving you cosmic permission here to not answer. Just don't reply. Another approach to this is to have some kind of an auto response that you have ready to go. I love a dot phrase here. I love you choosing pre-written text that you respond without even thinking to this message. And it can be as simple as, I am currently taking care of a patient. I am not able to answer this non-urgent, non-medical question. Please refer to, you could keep it just like that, right? You are saying, I am not going to be involved with this, basically. You could put additional language, if there is a concern that, you need help, please contact the manager, please contact the medical assistant. You may not be able to be that specific, and that is okay, because in the olden days, right, someone would have to get up from their desk. They'd have to come knock on the door. There is friction there that is very different from being able to send you, without looking at you, a message, right? I'm going to sit here and I'm going to type out a message while I'm smiling at Mrs. Jones, right? Me, the front desk person. And I'm going to ask, Dr. So-and-so, are you willing to see them, even though they have checked in 17 minutes, for their 20-minute visit? Let's just see, right? We are in a low friction state there, and I want you to increase the friction. Increase the friction by not responding so that they stop doing that, or responding with a non-answer. I can't answer your question right now. I am currently seeing a patient, right? It could say, if there is an urgent medical situation going on, you may, get the medical assistant, you may get the nurse on call, like whatever it is that you want them to do. You could say, you can come knock on my door. If you are concerned about, some kind of urgent medical issue, you want to increase the friction there. This is not meant to be mean to the front desk. This is to increase the friction so that they will adjust the way that they think about navigating the challenge, right? If they have discomfort in reinforcing the policy that is established in the clinic about the late check-in, then that needs to be addressed and worked through on their end. The appropriate answer is not to bump that to you, right? So we're going to increase the friction in, we are not going to solve the problem this way. It is not constantly going to be asked to the doctor, the physician, the advanced practice provider. We're not going to constantly ask them to override this policy. If they wouldn't knock on the door 15 times per day, we're not going to allow them to constantly be interrupting, again, with this non-urgent, non-medical issue, right? Dial up the friction there. Patient portal. Now, it is up to you, my friends, your policies most of the time around the patient portal. As the patient portal became more ubiquitous, patients got very used to and comfortable sending very long, messages and replacing appointments with medical questions through the portal. You get to decide, and I'm going to tell you, it is your responsibility to decide, what am I going to choose to handle or not? Because very few of us and not zero of us, but I'd say fewer and fewer of us are having messages really adequately triaged, right? You might have a nurse of some kind who is reading through messages, responding to patients, letting them know that sounds important, that needs an appointment. If you don't have that, or you do have it, but it's not reliable, then I want you to increase the friction in your response. Patient sends you multiple paragraphs with multiple questions. Write back. And again, here's a dot phrase. Thank you for your question. These are important questions, and I would love to be able to discuss them with you. Please schedule an appointment. Done. Sign off. If your pacing is such that you don't have support I'm assuming that you don't have the time covered to be able to sit there and write paragraphs back. And, assuming that it's not something that can be answered with another quick dot phrase or, look at this resource or something like that, because most of the time it's not, it's more nuanced than that, then you need to invite the patient to schedule an appointment so that they have dedicated time to talk to you about helping to navigate whatever it is that they're navigating. Now, we are going to run into issues there, right? Because patients are going to be like, well, you're booked out for 3 months. Well, you're booked out for 6 months. Well, you're booked out, blah, 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 blah. I don't want to come in. Can't you just answer my question? Again, if you don't think there's a problem here, then don't worry about it, right? If you have no problem responding to their questions and this works for you, I'll say, if you work in a direct care model and you are paid by the patient in such a way that you're reimbursed adequately for providing care outside of the visit, that's fine. You could say, well, I'm salaried, so it doesn't really matter. It does matter if you don't have dedicated time to be able to respond to the 26 messages that are in your box where everybody's written in 4 paragraphs. Now, there is going to be discomfort here. There is going to be discomfort here because you also know that you're booked way out. You know that there's going to be pushback. You know that patients want, you to respond and to be able to bypass, not for evil reasons, but they don't want to come in. They don't want to come in. They don't want to pay a copay. They don't want to take time out of their day, whatever. But we are not equipped to be able to sit and spend 5 to 10 minutes per message thinking through and navigating and responding. Again, I'm assuming that you are not set up to do that. And again, you probably have a volume of messages that you're addressing, right? So you need to figure out easy ways to dial up the friction for the patients, not because you don't want to take care of them, because you are not resourced to be able to take care of them in that way. This is not meant to be evil. This is not meant to not take care of your patients, but it is to acknowledge, right, that this cannot be a replacement for medical care. We did not invent the way that medical care is currently reimbursed and practiced and adjusted and, scheduled. We did not invent that. But we cannot also be the victim of it and to endlessly donate our time that is not compensated, that is not accounted for in the way that we are scheduled to do our work. Now, if medicine gets its head out of its butt and is able to say, oh, you know what? We can provide a lot of care this way. Maybe the reimbursement situation is not, adequate the way that we've been doing things. What if we scheduled, a certain number of visits and a certain amount of time for our, providers to be able to respond to questions? And what if we had the team be more, there could be a lot of different solutions right now. But until that day comes, you will need to learn how to navigate it. And again, unfortunately, we're going to need to dial up the friction. I think each of us as humans, right, we would love for there to be low friction. I can just send my provider a message. I can just send my physician a message. They'll just order me whatever I'm asking for. I don't want to waste my time. I don't want to waste my time, right? Finding an appointment, going and dealing with that. And on the other hand, I also want my physician to have a sustainable life. And knowing that she does not have time set aside in her schedule to be able to just accommodate my needs just because I don't want to be inconvenienced, doesn't make it okay for me to just assume that that's the way that I should be doing things either on the patient side. This is a whole area, right, where we as a society could make a lot of different choices. But I invite you to be able to say, you know what? My sustainable career is important, boundaries are important, and I'm going to dial up the friction in my response to patient messages. I love the phrase, thank you for your questions. This sounds really important, and I would like for you to schedule an appointment. I know that it may take some time for you to get in to see me, you could say. However, I don't think it's appropriate medical care for me to be able to, thoroughly investigate and answer your questions. Please schedule an appointment. You can come up with as many phrases. You can turn to AI to help you generate phrases, right? To auto-populate that you can just turn into dot phrases, be able to say. We can acknowledge that they're important questions. We can empathize that we wish the patient wasn't experiencing this, that we wish that the wait time wasn't so long, that if we think it's really urgent, that they should be seen more urgently and they should figure out how to do that, whether that's urgent care or calling the clinic to see one of your partners, any number of different ways, right? But we cannot continue to donate our time. We don't have it. It is literally sucking the life out of us. Go back and listen to last week's episode, right, where I talked about the realities of harm to us in healthcare. So, another area for us to dial up the friction is the difficult patient who disagrees with you. Now, people pleasers, I love you. I know you. I am you, right? This is a real challenge. And I'm not suggesting that we be rude, that we be mean, any of those things. And I am assuming in this circumstance that our patients have other choices in terms of other people that they could see. That is not going to be true if you are a super subspecialty person, or perhaps you work in a community health care, even if you work in a community health system, there are other options. So again, I'm going to acknowledge that this is a privileged position, but the difficult patient who cannot communicate well with you, who constantly disagrees with your medical advice, and they continue to come back and see you. You are allowed to dial up the friction and let them know that your position is based on the evidence, your experience, and they are welcome to seek other opinions. They are welcome to, change primary care physicians. They're welcome to get another specialist involved, a second opinion from another specialist, perhaps in your department or perhaps at a different institution. Again, I'm assuming here that we are in a setting where there is some choice involved. I myself will find myself sort of wrestling with these patients who continue to come back to see me. They don't seem to like me. They don't seem to like the choices that I'm giving them. They sort of are never on board with the plan. And I was like, why are you back? Why are you here? Not from a cynical, mean place, but I'm just like, you have other options, right? You know that I'm not the only person in this clinic or in this general vicinity who could be caring for you. I would argue that there are sometimes weird dynamics that we don't understand, like the patient actually trusts you a lot more than they're sort of letting on. But it is also okay for you to set some boundaries in such a way that invites the patient to sort of have, the idea that they don't have to come back to see you. It's okay if they don't agree with your policy on opiate prescriptions. That, it's okay, okay, quote unquote, right? That their past physician did things in a certain way and you disagree and you will not be carrying forth their plan. And so you are going to come up with a taper plan for their opiate medicine. You understand that they don't agree. You are not their only choice. And if they don't agree with that plan, they are welcome to see someone else. But you can safely have a boundary and say, this is what is available here from me. People may find that no matter where they go, the options are the same, right? In this opiate example, right, they may find that, yeah, every stupid doctor that they see wants them to taper down on their meds, and they can't find a doctor like Dr. So-and-so who was there and their doctor for 30 years and on and on and on. That person is grappling with the reality that things have changed in our understanding of what's okay and what's not okay. It is not your job. Now, sometimes we are the person who's going to help that patient, have a breakthrough. But you are welcome to have the boundaries, whether they are, kind of your medical boundaries in terms of what you will and won't do in being part of their care. And it might also be, some other kind of non-medical boundary, logistical boundaries. Like, I am willing to add them on at the end of the day, but I'm not willing for them to be the first appointment of the day because they inevitably show up late and they inevitably, take the day, astray, whatever it is. It is okay for you to decide how you will navigate these difficult patients because, frankly, we need to have safe and healthy boundaries with difficult patients in order to be able to sustain our careers in medicine. Again, I recognize that that is a privileged circumstance, and it's not going to be as feasible as we would like it to be, right? If we are working in the emergency room and there is one emergency room in town, they don't necessarily have another option, right? Does that mean that you will automatically go along with whatever treatment or test it is that they are, demanding? No, but they may not have other options, right? And so you will need to decide your boundaries in that relationship as well. So, all right. Another area where I invite you to dial up the friction, right, is when you are invited to participate in, I'm thinking, non-medical, non-clinical opportunities that do not light you up, right? Committees, meetings, leadership, some kind of thing that you are asked to take over, party planning, right? Women physicians are always tasked with party planning. I've not seen my male colleagues, either step up and volunteer for that or be voluntold for that kind of stuff. But we all know what I'm talking about. When there are things that, again, don't light you up, you're not that interested in doing, that are, not at all care related, no one's health is going to be affected by them, it is okay to make it more difficult to get yourself involved with that, right? Well, I understand that you want me to join the committee. In order for me to join the committee and have the time and energy to devote to that, I'm going to need, to have an appointment blocked off the schedule on those days when the meeting's going. I'm going to need some admin time. If you want me to, I don't know, contribute to the patient newsletter, I'm going to need some time set aside so that I can do a high quality job. It is okay to find ways to say no or no unless, right? And create some healthy boundaries there. It's okay to do that because we have to. We have to take care of ourselves. We have to protect ourselves and our boundaries. Now, there are also some places where I would like to invite you to dial down the friction. Dial down the friction that is involved with getting your notes done and closed. Whether this is using an AI scribe or an in-person scribe or creating more dot phrases or templates for yourself that make it easy to get the clinical information down so that you can close the note, whatever it is that we need to do to dial that down, bullet points, writing less, whatever it is, we need to do that. We need to do that because people are drowning in the time that they spend on the documentation. Now, again, there are a variety of different ways that you can tackle this, but there are things I know that I type over and over again, and I have to remember that needs to be a phrase. I need to make that into auto text, right? Um, I've mentioned before that I use an AI scribe, and it's an AI scribe that I can customize the templates for. And so every once in a while, I tweak or invent a new template, right, that can help to support making it easier. That's me dialing down the friction. Now, there is a little friction involved in sometimes creating, hiring, training, those elements of it. But I can't tell you how grateful I am every time that I realize, oh, I've made it through the day. These things are done. These things are, just it's done. It's easy. Dial down the friction. Another place is saying no electronically. Again, this is a great place to have dot phrases or auto text, whatever you call it, that you can say no. And we can say no in different ways that don't necessarily involve actually saying no, right? Again, I gave you an example of this before. That is a great question, and it is important that we talk about that. I invite you to schedule an appointment. I'd like you to schedule an appointment. I'd like you to call my nurse and, blah, 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 blah. Whatever it is, you are saying, no, I'm not going to answer that here and now because I'm not going to take my time to do that because that is not an appropriate way to deal with this problem. Or it might be an appropriate way to deal with this problem, but frankly, I'm not resourced because I have to see 30 patients a day. Whatever it is, right? Say no electronically. Similarly, like you might have an email response where people are asking you to do things and you've got pre-written text. So it's just easy. Or again, the messages in Epic Chat, you've got pre-written text. You don't even have to think about it. You can just respond, I'm not available to answer your question right now. And make that a little, so you just type in a few characters, right? And out pops this nice phrase, I'm not able to answer your question right now. If this is a medical emergency, please do such and such, right? You've reduced the friction for yourself in responding. So notice in that example, right, we've dialed up the friction in that, no, this is not an appropriate way to solve this non-medical administrative problem that you're having. And we've reduced the friction by making it easier for us to say no electronically, right? Lovely. There is a nice meeting of the minds there. So we can do this in the chat function. We can do this in our inbox, our medical inbox as well as our email inbox, right? Make it easier for you to say no electronically. Again, you can use polite language. You don't even have to think about it because you have done it in advance. You can now, pull up ChatGPT or whatever your AI, tool of choice is, and you can ask it, please, I am a busy physician and I have to see so many patients a day and I frequently get messages like this. Please come up with auto text, right? That helps me respond to the patient or the staff or whatever, right? It can write it for you. It can be very gracious and lovely. It can communicate that you think that person is important and you think their questions are important, but you are not able to answer them in this medium, or that it's not appropriate for them to interrupt you, but in polite language that communicates this is not a way to solve the problem of Mrs. Jones being 17 minutes late for her 20-minute appointment, and we've got a policy about 15 minutes, right? We can have easy auto text to be able to send it back so that we reduce the friction, we make it very easy, we get it off our plates. Love it. The next and last thing that I have on my list for you of things to dial down the friction on is anything that helps you to be able to live and work more healthfully or more sustainably. So that might be things such as people to come clean your house, meal prepping, right? So that you have healthy lunches and you're not constantly scrounging for donuts in the lounge. It might be setting your exercise stuff out, right? So that it's just easy for you to wake up in the morning and put on your exercise clothes and get out the door. It might be registering for a class, like an exercise class that happens after work, right? At 5:30, and your last patient, like you're gonna have to stay on time to be able to get to it. And there's some kind of a cancellation policy in place that you're gonna forfeit the cost, right? If you don't show up, right? It's gonna put a little friction the other way, right? Of, ooh, I'm putting friction in place that is uncomfortable for me to not show up for that class. I know I feel good when I actually go and I actually do the class, but there's friction there of like, oh, I have to go more quickly, right? If we make it a little bit unpleasant or uncomfortable to skip it, right? Because we've signed up, we're gonna do a cancellation thing, um, we're gonna be losing, money or whatever it is, that is going to help us. If it's a meal service, if it is, a after school hours nanny who drives the kids around, there could be any number of things. But where there is a way to make something in your life easier that helps you to be healthier or to have a more sustainable, career or time as a parent or whatever it is, do it. Please do it. Take care of yourself, knowing that things that help you to be healthier, that make it easier for you to be healthier, are in your best interest. All right, my friends. So this is friction management in modern medicine. So areas that we talked about dialing up the friction include non-urgent, non-medical questions from staff, especially ones that are interrupting you in the middle of clinical care. Messages in the patient portal, dealing with difficult patients who are disagreeing with you. Again, it's not that you're refusing care, it's that you are sticking to your boundaries and making that easier for yourself, but maybe more difficult for them in some way. Now, again, we could have a whole episode about that, but please go back and listen to that part. This is not meant to make you an asshole. And non-medical tasks that don't light you up, right? We want to increase the friction so that we are not constantly being voluntold or saying yes because we are uncomfortable to say no. We want to make it more difficult. Oh, I'd love to participate in that, but I'm not able to do that unless I have some admin time set aside, right? Something along this nature. We want to dial down the friction with anything that helps us get our notes done more quickly. With saying no electronically, we want to make it easier for ourselves. We might have to come up with some pre-populated text that we could just do a little dot phrase and get it out there, right? And anything that helps us to be healthier, right? And again, we can invoke this seasonality of this. It might be that you have tiny children at home and you wouldn't normally hire a cleaner or someone to do your laundry, but you need to do that right now in this season because you are behind and you don't want to be spending your precious little energy doing that, right? Do that. Help yourself. If you magically have more time for it later and you want to go back to doing your own laundry, great, no problem. That's easy to do. It's easy to cancel that. Probably won't do that because you'll probably realize, hey, you know what? Getting help really helps me and I like doing that. So I'm going to keep doing it. All right. My friends, I hope this has been helpful. As always, please feel free to send me a message. You can reach me at Megan, MEGAN, at healthierforgood.com. I'd love hearing from you. Until next week, take care.